Not all heel pain is plantar fasciitis. Tarsal tunnel syndrome is compression of the posterior tibial nerve as it passes through the tarsal tunnel in the ankle, and the literature describes it as an underdiagnosed cause of heel pain and foot dysfunction. If months of stretching, orthotics, and rest have not helped, the working diagnosis is worth revisiting rather than repeating. Start with what is actually inside that tunnel, because the anatomy explains the symptoms. The tarsal tunnel holds the tibial nerve, the posterior tibial artery, and the tendons of tibialis posterior, flexor digitorum longus, and flexor hallucis longus. When the tibial nerve is compressed within that space, the result is pain, numbness, tingling, and weakness along the distribution of that nerve. Those last three are the tell. Plantar fasciitis is a tissue problem, and it hurts. It does not typically produce numbness, tingling, or weakness. When any of those three are present alongside the heel pain, a nerve is involved, and a treatment plan aimed only at fascia is aimed at the wrong structure. So why does this diagnosis take so long to reach? Two reasons, and both come from the same review. The first is that the clinical presentation varies, because there are numerous possible causes and a range of structures involved. Symptoms may develop insidiously over months to years, or they may begin after trauma. Either pattern is consistent with the diagnosis, which means the absence of an injury does not rule anything out. The second reason matters more. There is a recognized lack of definitive clinical tests or imaging for this condition, and that lack often delays diagnosis. The review is direct about the consequence. That delay contributes to poor patient outcomes and lower treatment success. This is not a condition a scan reliably settles. That is exactly why it slips through. If you have been told your imaging looks fine and you left it there, understand that a normal scan is not the same thing as a normal nerve. Now, the part that changes how urgently you should act. In severe or long-standing cases, permanent nerve damage may occur if the condition is left untreated. The review is explicit that early diagnosis and intervention are key to avoiding permanent nerve injury and key to getting the most from treatment, whether that treatment is conservative or surgical. That changes the calculus on waiting. With plantar fasciitis, watchful waiting is reasonable. With a compressed nerve, time is not neutral. Months spent stretching a fascia that was never the problem are months the nerve spends compressed. So how does the question actually get answered? Because no single test is definitive, the approach is to combine the symptom pattern with testing that measures nerve function directly. Nerve conduction studies and electromyography assess whether the tibial nerve is conducting normally. That is information no ultrasound and no X-ray provides. Imaging shows you structure. These studies show you function. When the complaint is that a nerve may not be working properly, function is the thing that has to be measured. At the Padda Institute, that testing is described under electrodiagnostic testing. Foot and ankle pain, more generally, is covered under foot pain. Where a nerve is entrapped in scar or adjacent tissue, hydrodissection is among the options discussed. And where diabetes is part of the picture, nerve vulnerability and neuropathy alter both the picture and the treatment plan. So diabetes and neuropathy is the page to read. A few questions come up every time. How do you know your heel pain is not plantar fasciitis? Numbness, tingling, or weakness alongside the pain suggests nerve involvement rather than a fascia problem, since tarsal tunnel syndrome compresses the tibial nerve. Why has no scan shown anything? Because there's a recognized lack of definitive clinical tests or imaging for this condition, and that is one of the main reasons diagnosis gets delayed. Nerve function has to be measured rather than pictured. Can it come on without an injury? Yes. Symptoms may develop insidiously over months to years, or begin after trauma. Either pattern is consistent with the diagnosis. Is it safe to keep waiting to see if it settles? Not indefinitely. In severe or long-standing cases, permanent nerve damage can occur if untreated, and early intervention is described as key to avoiding permanent nerve injury. None of this means every stubborn heel is a trapped nerve. It means that when stretching, orthotics and rest have been given a fair trial, and the heel still hurts, the sensible next move is to question the label rather than repeat the treatment. To have persistent heel pain evaluated, request an appointment at painmd.com. painmd.tv/appointment. Call 314-481-5000 or text 314-886-5902. We have 2 locations, 4477 Woodson Road, Suite 100 in Street Lewis, and 12174 Natural Bridge Road in Bridgeton. You do not need a referral, and you do not need to be an existing patient. Request an appointment at painmd.tv/appointment. Call 314-481-5000 or text 314-886-5902.